Cha-cha. Hola, 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 hola.
Hey, what's up?
I gotta zoom in because I didn't do my bed today. ¿Qué pasa, mi gente? It's your girl, Becky G. Aquí estoy en mi casita, en cuarentena, con mi familia en Los Ángeles. Espero que todos están bien de salud y con sus familias. Les mando mucho amor y muchas bendiciones. Estoy pensando en ustedes cada día. Quería avisarles que en este video voy a estar hablando en inglés, pero vamos a tener subtítulos porque hay mucha información que es muy importante para nuestra comunidad. So, let's try it out. Subtitles, right here. You see them? Can you see the subtitles? Oh my god, that was so Dora. Anyways, as you guys can see, this video is very different than anything we've seen on my YouTube channel before, and that is for a reason. YouTube and I have come together to brainstorm on what we can be doing to help one another in these tough times. And part of that is educating ourselves. So today, I'm going to be sitting down with Dr. Rios, and she is an incredible woman, so accomplished and lovely enough to take time out of her day to talk about the serious effects of COVID-19 on the Latin community as well as other minority communities. And I hope you guys find this conversation impactful, insightful, and more than anything, get the feeling that you guys are not alone because I promise you, we are all in this together. All right? Besitos, and here it goes. Really appreciate your time. I was really looking forward to this. Obviously, everything that's going on right now, it's kind of like we're in the midst of the madness. There's so much information being thrown around.
Right.
It's really hard to tell what's real. It's really hard to tell what's not been validated just yet. And so, especially now in this generation where like it's so easy to access everything, right, with the internet. And I feel like if you're not being affected personally, you're still witnessing it happen in real time because of social media and because of the internet. So it's hard not to feel overwhelmed, you know, by everything, all the information that's being thrown around right now. So like I said, I really appreciate your time.
No, thank you. I'm really happy to be here. And, you know, I work in Washington, D.C. and involved with so many different issues for Latino health. But, you know, with our National Hispanic Medical Association, we're committed. We're doctors. I'm from Los Angeles. We're doctors.
Really? What part of LA?
Whittier, California.
Really? Okay.
Yeah. And anyway, we're doctors from all over the country that committed to helping improve education and information to Latino families.
That's incredible. So you're from LA, you now live in Washington. Obviously, you've made many power moves now. You're doing so much to help, you know, our community. And first off, I commend you for that because it's a big responsibility. It is something that it can be very intimidating for a lot of people. And you've just been doing it. So I applaud you. That's amazing.
Oh, thank you.
Well, now that we've gotten to know a little bit about you and where you're from and what you're passionate about, I'd like to know too, you know, what inspired you to get into the medical field? What inspired you to become a doctor?
Oh, well, when I was in high school, my mother was studying to be a nurse, and she got me a job at the local community hospital, Beverly Hospital in Montebello, and I think that's what did it. When I went to college, I went to Stanford University when I was 18, and right away became pre-med.
Real quick.
But I understood the importance of health. My dad was a factory worker, but we had health insurance, and we grew up, I'll say, lower middle class, but very committed to going to the doctor. And I think I understood how important health is. And saw how a lot of people in our poor communities don't have access, and either they don't have doctors in their families. We don't have very many Hispanic doctors or Latino doctors or nurses at all. So my mother became a nurse and inspired me to go into medicine.
Wow. So it runs in the family. That's a beautiful thing. That's a
Mhm.
it's a beautiful story, and it's something that, as we know, it's been around, that battle, right, that our community and many minority communities have faced. It's access to
Right,
healthcare. Can we even afford it? Are we even, do we qualify for it?
right,
And now, segueing into what is COVID-19, that has now become a global pandemic, has completely taken over everyone's lives. Um, I think it's important that, we really focus in on how that amplifies that battle even more so, right? Not having the same
all right,
access to healthcare, not maybe qualifying for it. And so our communities are being highly affected by that. And it's always been something very sad to see, but now more so than ever, because there's something that we for sure have no control over. Before, you can say that having access to healthcare was in other people's hands, and that there was
hmm,
stuff that could be done in the system to protect the people. But now COVID-19, it really doesn't care who you are, where you come from, what the color of your skin is, what money you have in the bank account. If it gets you, it gets you. And these communities are so vulnerable. I mean,
right.
so vulnerable. And so I have a couple questions that kind of go into this. Um, First off, what are the percentages of infected individuals and deaths for different age groups? First, we heard only the elderly can be affected, but now there's been, new studies that other age groups are still being affected. So, what are those percentages for these different age groups?
Yeah, I looked up the CDC, the Centers for Disease Control and Prevention, and their percentages, if you think about it, it's really easy. It's a third, a third, a third. 18 adults, 18 to 44, 45 to 64, and then 65 above. So it's pretty evenly spread. What everybody's focusing on is not how many people get it, but the deaths. And when you look at the deaths, it's alarming, but most people that are over or under 60, only 1% are dying from the disease.
Okay.
So, but above 60, from 60 to 69, 4%, from 70 to 79, 8%, so double the numbers, and
Wow.
above 80, 15%. So, that's where we really see more people having problems. And
Right.
I just, I think it's important though that 60-year-old, 65-year-olds and above, they have a lot more extra problems than younger people, because by that
Mhm.
time our bodies have been stressed out, living in communities like you mentioned, with a lot of what we call toxic stress, crimes, gun shootings, gangs. Some of our communities that are poor and don't have the right type of food, fresh fruits and vegetables. And then we don't have, we're working, our families are working two jobs. They have to work, they just can't stay home. And so we have a lot more stress in our communities. And, we have families that have mixed families. Some people are not
Yeah.
documented.
Mhm.
They've been working here and very productive. So with all that extra stress, we see obesity and diabetes sooner than other
Right.
communities.
And because of that, I think it's safe to say too that it's not just the our health in the minority communities that can be triggering these things, but it's also just the economic difference, right? Because
All right.
I grew up in Inglewood in LA. I'm one of four kids. My parents are high school sweethearts, so it's six of us. And I
Mm-hmm.
remember, growing up, it was much more efficient with our money to go eat fast food to feed all the kids and make sure everybody was happy, with their happy
Yeah.
meals and whatnot, than to go spend the same amount on four apples at a grocery, organic
Right.
mainstream grocery store.
Right.
So when we're talking about, the economic difference, that is also what leads to our health, right? And that increases the obesity, that increases heart diseases, and it triggers those things in our bodies. You know, a lot of these things can be pre-existing. You can be born with these things, or also they're just induced by our surroundings because we don't have access to anything else. And so I think that's been an interesting thing to witness. An experience, because even for me, you know, speaking back to the elderly community, I'm very fortunate and blessed to have all four of my abuelitos very present in our lives, and still very healthy. But we worry for them. We worry for them a lot.
Oh,
I have two grandparents that live in Jalisco in Mexico, and they're currently in their little pueblito. They are safe. They are in no harm's way, have access to, you know, the stuff on the rancho. They have their chickens for their eggs. They have their beans, their rice, all those good things that they need access to. But then I also have my other set of grandparents who live very close to me here in LA. And it's hard for them because they're so used to their everyday life. My Lito loves going to the grocery store to pick out his fresh avocados and his tomatoes and his produce and all that stuff. And it's been very sad to have to sit down with him and explain to him, you know, that this has nothing to do with if you are capable. I know you love that sense of independence to go and get these things for yourself, but there's something bigger happening. If I, the healthy one, am home and choosing to stay home for my safety and for your safety, that should show you that you for sure should not be leaving your home, you know? And so would you have any advice that I could either share with my grandparents, or that whoever's watching this, you know, maybe has that similar dynamic, right? Maybe their parents are the same age as my grandparents, and they're struggling, you know, with getting it, you know, into their heads that this isn't something to mess around with. What would that advice be to help them stay healthy?
I think to stay healthy right now in this pandemic, the biggest thing they can do is stay home. But social distancing, like we say, you know, being 6 feet away from other people, because this virus goes from person to person and also stays on doorknobs and things in the home. The best thing, though, is to realize that social distancing does not mean social isolation. And mental health of the elderly, especially, who are so used to having family and friends, even saying hi to the mailman or going to the stores, the supermarkets, that's what they're going to miss the most. Or going to church and seeing some, you know, friends there. So I think what's most important is that other family members call them, even mail them a letter. You know, we forget about mail, mailing letters, cards. But also, I think what's important, I know for my parents, they never knew about computers. And I think technology, we have FaceTime. We used FaceTime with my parents before they died. But FaceTime, or, you know, any kind of app that allows you to see the other person in your close support group, is important, not to have isolation. And there's a lot of other things too, but I think that's the most important.
No, I definitely agree with that, and I think it is an interesting time, because in even times in times like these, what I've dealt with personally, as far as mental health goes, I've, you know, suffered from anxiety. I've battled with anxiety for many years now. You know, as of last year, I was officially diagnosed with depression, and I've done everything I can in my power to, you know, strengthen my mindset, get myself to a healthier, better place. But times like these are very triggering. And I think there's also a lot of, you know, tabooness around the mental health conversations when you come from cultures like ours, right? Where it's like, oh, you're just sad, you'll be fine tomorrow, just eat something, mija, you're gonna be okay. And it's like, but there's something happening up here that I can't really explain. I know myself to be a very happy person, and there's just this little cloud. And in times like these, when the little cloud is very present, it's very easy to self-isolate, and not just distance wise, but literally go into your little shell, go under the
Yeah.
rock. You start
Right.
not, contacting people. And I think it's important that we have these conversations, because I even see it with my grandparents. You're so right. It's so
Hmm.
important to reach out even more in times like these, and try to
Definitely.
connect, because I know if I have it, just because they're older and they've maybe got more experience in life, even more so, they could, be suffering of those things as well. And I think because we're, from the culture that we are, we take a lot of pride in being so strong, and it's hard sometimes to admit that you can be sad, that you're dealing with grief, of what
Right.
your life used to be. And the idea that it may not ever be the same after this is also a lot to process.
Right. But I do think
Yeah.
on the positive side, there's going to be a positive awakening of people in this country. And I think one of the biggest things that you've already mentioned is that our communities, especially the Latino community, we're the backbone of this country. We're the farm workers, we're the hotel workers, we're the restaurant workers, we're the people that are in all the healthcare systems, whether they're clinics or hospitals. And we're the workers that this country has to, have more respect for our people and African American and Native American peoples. And I think our communities that suffer because we're in poor communities need to be really uplifted with a lot of funding and jobs and education. It's not going to happen overnight, but I think there's a big awakening in this country that our communities, because we're the ones dying the most. It's not because of the pandemic. It's because we have never had access to a fair
Exactly.
uh, level playing field. So, but
Mhm.
anyway, I think it's great what you're doing, and
Thank you.
you have to be positive. You have to be
Yes,
positive.
100%.
Hmm.
No, I agree. And I think it, like, going back to, coming together, something that I like to, live by is, they say we are the minorities, but we are the majority.
All
Estamos
right.
presente. And I
Yeah.
think that is one of the most beautiful things about our culture, is that pride. We are so proud of
Yeah.
where we come from. And the American dream, it comes in so many different colors, and it
Right.
comes in so many different cultures, and it is spoken in so many different languages. But that dream is what unites us all. And I think that right now, especially in brown communities, most definitely, that has been a battle,
Yeah.
for so long. I mean, before I was even here, before my parents were even here. And I feel so strongly and so passionately, even just speaking with you, and us coming together and joining forces
Hmm.
alongside your colleagues, and everyone else you work with on your side, and same on,
Yeah.
on my end,
Yeah.
because
Good.
we now have these bridges to be able to connect the dots and bring awareness, at a level that, to be honest, it's like, these are things I feel like internally we already knew. I think we
Right.
already knew that our race is very different
Hmm.
than others. I think we've
Yeah.
witnessed firsthand and experienced personal experiences that, are heartbreaking. And when you put this in the COVID-19 perspective, we were exposed. We were more exposed than anyone else.
Right.
And it's true. And the proof is in the numbers. I hear it
Hmm.
on the news every single day. And I think, us educating our communities on what the safest things to do, I think
Hmm.
the best approach is, don't wait for our leaders to take care of us and make
Right.
the best decision with everyone else in mind, because that day may not ever come. So what can we do to protect ourselves?
Right.
And I've been doing research on, which companies are helping undocumented families and immigrant families that don't have access even to food.
Hmm.
They're losing their jobs. And like you said, a lot of immigrant families are the backbones of this country. And so now they're with nothing,
Right.
absolutely nothing. And so
Well,
just doing that research, I think, is very important. And I have just a couple more questions for you.
sure.
As far as, i I grew up with one of my grandmas being very, very true, Mexicana del rancho, what the earth gives you, is what's great for you, right? The roots,
Right.
what Mother Nature has to offer. She was always having her yerba buenas and all those
Right.
things. And a
Right.
lot of talk right now that I see, and this is also just across social media, right? They're saying, Western medicine is a great option, but what can we be doing naturally to be boosting up our immune systems and protecting ourselves? Is too many vitamins bad for your body? All those things, right? So I have all these questions.
Right.
Do you think it's good to start implementing those like little things, those natural things at home, to help boost the immune system, even exercise? Like, would you
Definitely.
recommend those things? Do you think?
Definitely. I think definitely the importance of exercise is very, very important to keep your mind and body flowing, your energy flowing. And what's the worst thing about our bodies is that we tend to keep a lot of toxic stuff, whether inflammation stuff. So it's best to have. It is good to have vitamins, especially the vitamins like vitamin D, the sunlight. If you can't get enough sunlight, we need to get more sunlight. Vitamin C from our fruits, and vitamin B, and those help the immune system. But and I have a whole list of things, but turmeric and other things you mentioned, yerba buena, and the teas. We need to drink more tea instead of just coffee. But I do think that all the leafy green vegetables in our fruits and vegetables. And then when we talk about protein, we already eat beans, lentils, having chicken and fish. And I think, part of the problem with meat right now is that meat prices are going to be going up because of what's happening in the meat packing.
Right.
And that's, again, happening to our communities of finding that they have been working so close together and not having the extra protection masks and gloves, that they're getting more sick. So the meat packing plants are having problems. So our meat is going to be going up in price. But I think that I think you're right that we need to have better home cooking, and even growing our own food if we can, because our farmers markets much better than the big chain markets are getting stuff that's more processed foods, and that's part of the problem of why we have so much obesity.
Right.
Our food systems.
No, it totally makes sense. Yeah, it's definitely, it's just, again, this is all things that we've lived firsthand, but it also feels like something that's a lot easier said than done for many people, because we're breaking generational cycles here. And now we're doing it out of necessity. Now it's not, oh, just because I want to have, fresh green tea every single day. Now it's like, okay, we really got to commit to this. This is actually, I think, the most serious I've seen any of my family members, and even my parents who are young. They're scared. They're very scared. It's a matter of, like you said, going outside 15 minutes a day, get a stretch in the sun. You don't have to do crazy workouts. Be kind to yourself. Don't be too hard on yourself. But be mindful, right? It's just practicing that mindfulness, and just saying, like, I'm gonna do good for my body, because it's a battle. It's a battle of life or death now, and I'm not going down without a fight, and I think it's important to have these conversations, so that people get inspired, because, like I said, it can be scary, it can be intimidating, but it's not impossible, and they're not alone. We're all in this together. Another thing that I wanted to ask was, what are some of the best habits that you think we could be creating for keeping our houses sanitized, especially if we don't have access to a lot of money? If we don't have access to go into the grocery stores every single day, we're for sure not going to be able to go to the wholesale food places to get all of the sanitization products that we need. So what are those habits?
So there's two or three different things. One is we have to wash our hands more, because we always end up picking up something, and then we're not supposed to touch our faces, because whatever you have on your hands, you end up putting on your face. So soap, just washing your hands. The second thing is, how do you keep your surfaces clean? Your phones, your doorknobs, and things that you end up touching, you need to clean with simple products like a Lysol cleaning or a disinfectant spray, or even the Comet or Ajax, the powdered, that's bleach. Those are
What about
that's just
Fabuloso?
bleach. Yeah, whatever. It's just, and having something simple, like you said, you don't have to have a bunch of different products. It's really about keeping things clean, and the viruses get killed off with these disinfectants.
And would you recommend, as far as like, the lifespan of this virus living on surfaces and products, if you do go grocery shopping and you're bringing outside things into your home, do you recommend disinfecting those things? Because I know I read somewhere that, especially like frozen products, right? People are like, stock up on frozen products because they'll last you longer.
Right.
But if they're contaminated and then something lives in the freezer, you don't know how long it can live in the freezer and things like that. I don't know. Again, this is all just stuff I read on the internet.
Yeah. No, I think when you buy fruits and vegetables from the store, you should wash them. Definitely. It's just like, they come with little specks of dirt because they come from the ground. So you just have to wash them. And the same with any boxes that are covering boxes that are covering your pizza or what have you. Want to just dust them off. That's all. I mean, I think that most stuff that we get is okay.
Right. Okay. So that's good to know. That also.
Yeah.
So another question that I have too is kind of clarifying. So I know there's different testing, right? There's to get tested if you currently have the virus, and then there's also antibody testing that I've seen is a little flippy floppy right now, not so trustworthy just yet, because some people were getting false positives and things like that. As far as access to testing too, I mean, I know we're trying to get testing to everybody, but there's still some places that won't test if you're not showing any symptoms, but also people can be carrying this virus without any symptoms. So as far as testing goes, do you recommend people, if they have a feeling that they might have it, that they go get tested anyways? And then as far as your views on like the antibody testing and the future in that?
So they say about 30%, again, this is CDC, says about 30% of people don't have symptoms. And the basic symptoms, right, is feeling like you have muscle aches and fever and coughing. And some people just have a simple, or not simple, but a less infection, but they still have like a loss of taste or a loss of smell. And then there's the other spectrum where when people get real sick, they have shortness of breath. And if there's a high fever and shortness of breath, that's when you call 911. But other than that, the testing, and I think it's going to be more important now that people want to go back to work as things open up. Some employers are going to say, well, we want you to get tested if you have any fever and if you have any symptoms. The testing for the infection is what is that swab test that goes into the back of your nose. And that test, that just tells you if you have the infection. And there are a couple different types of tests that can tell you right in 15 minutes at the testing site. And then there's another test that takes a couple of days. And so that's the viral test. The other one, the blood test, tells you if you had the infection in the past. That's called the antibody test. Now that can be negative. It could be positive. And that's what the problem is, that it could take up to a couple of weeks to have antibodies in your system after you had it. So you really want to wait a few weeks to have a more accurate test. That's been the biggest problem. But I do think that in California, the Department of Public Health for the whole state can tell you where to get tested. And in every county of Los Angeles County, Riverside County, Ventura County, they all have their own public health department that tells you where the testing sites are. And there will be a lot more testing in different neighborhoods as we move forward, because we need to have testing to know, who can go back to work.
Right. Which obviously there's a lot of talk about people, wanting to get back to work, wanting to get back to their everyday lives. Some people are on the side of caution, more like my family. We'll just hang out here. We're all right here. But I know that that's not the case for everybody. But as far as the access to testing, actually, a family member in my family, not to give too much information, actually, I set up an appointment for them through
Mhm.
through the Los Angeles County website, and
Mhm.
had no
Good.
issues. It was very efficient, super fast. So again, if anybody, this person had fever, this person was showing
Oh
the
yeah.
symptoms. Fortunately, it came back negative, which is really great news. But of course, always, stand on the side of caution, and it doesn't hurt. All you got to do is just go get that little test done, and you make sure that you're safe, most
Right.
importantly, and that the ones around you are safe as
Mhm.
well. So something that I think not a lot of people still understand
Mhm.
is the difference between coronavirus and COVID-19. Are they the same thing? They are not, correct?
Right.
Coronavirus is the umbrella that COVID-19 lives under. COVID-19 is the newfound disease that we have yet to have seen ever in human
Right.
beings.
Yeah, we've had coronaviruses before. The SARS virus was a coronavirus, and a MERS virus was a coronavirus. It's a family of a virus.
Mm-hmm.
Just like HIV is another family of virus, or influenza is another different influenza viruses.
Mm-hmm.
So this is a virus that is much more aggressive, especially with people that already have a poor immune system because they've had long-standing diseases, especially lung diseases. And I have to give a shout out for young people not to vape, because you'll end up being addicted to smoking cigarettes, or smoking nicotine, whatever you want to call it, vaping.
Mm-hmm. Mm-hmm.
But I think vaping, smoking, asthma, any kind of respiratory disease, any type of autoimmune disease. We have a lot of lupus in our families, and any type of diabetes and heart disease really breaks down that immune system in your body to fight off this virus. And that's why it's so
Right.
dangerous for people that are
Right.
older. And some young people too have had really bad problems. But hopefully we'll have a vaccine in the next year, a year and a half. And just like we had vaccines for polio and measles, and that we will see the disease lessen as more people get the vaccines in the future.
Right. Wow, that's amazing. I think
Yeah.
the idea of having an option to protect yourself, that's the thing, is right now a lot of people feel like they're being left behind. There's no cure. There's not a lot of information out there. And that's the reason actually why I asked the
Mhm.
question, because especially, people, there's been different names being thrown around, and people use it as if it's the same thing. I remember seeing very early
Yeah,
on someone say, "Look, they've been treating horses for coronavirus for so long," and it's like, yeah, they have, because that is a type
right,
of coronavirus that they are treating them for. But COVID-19,
right,
that is the battle. That is the battle we are currently in, that we have
right.
no answers to, really. The only answers we do know is that there are certain communities, certain groups of people that are being
Mhm.
highly affected by it.
Mhm.
If not firsthand, we're all in it together. We're all experiencing it together.
Yeah,
So thank you for clarifying that.
just to clarify, COVID-19
Hmm.
is short for coronavirus disease 2019.
Got you.
So
So the
that's the
co,
new name, COVID, coronavirus disease
right.
2019,
Okay,
because
totally makes sense.
it started in 2019. Yeah,
Right. And
yeah,
and then we first heard about it. It was what, end of
yeah,
January, beginning of February.
yeah, yeah.
It's it's crazy how much, like, time passes quickly as well. I mean, the days have been
Right.
mushing together here at home, and it's
Yeah.
it's it's fortunately we all like each other. I hope you're in quarantine with,
Oh yes.
ones that you enjoy spending time with, because if that was
Yeah.
not the case, this would be I'd probably be in a different mood right now.
Right. Right.
Yeah. Awesome. Well, I think as far as all of my questions, I feel like we've covered so many bases.
Oh yeah.
Um, is there anything else that you really feel passionate about letting our communities in on, you know?
I think, like I said earlier, that something good will come out of this. And one of the things that we feel passionate about, and again, because I work for and started this organization called the National Hispanic Medical Association, we really,
Hmm.
really believe that more young people should go into healthcare. There's lots of jobs. We can't outsource healthcare. And we have lots of medical practices, dental practices, hospitals, clinics that need our community to be a part of the system and to
Hmm.
help our community access the system because they're culturally and linguistically, able to help.
Right.
And so, we do mentoring and we give scholarships to
Oh,
young Latinos.
amazing.
Yeah,
I actually have a
we
cousin
want
who's
we
studying
want to
to
see
be a nurse.
more.
Yes,
So,
definitely.
so if
I think
anybody
that.
wants to learn about it, we'd be happy to help.
Well, I'm happy. I hope everybody who's watching this is listening and is super inspired by what you guys have, accomplished yourselves personally, but also, the future dream of sharing with everyone else. Like you said, the access to healthcare. Although we don't have very much of it, we can start providing it for each other if we take that approach. If we start studying and encouraging each other in that
Right.
way. So yeah, like I said, whoever's watching this, I hope you get inspired. If
Yeah.
you want to become a doctor, if you want to become a nurse, if you want to do anything in the medical field, the truth is you would have a lot of clients for sure, a lot of
Right.
patients that would be coming in because I know for me personally, my cousin, she's studying to become a nurse.
Okay.
And I have a couple family members actually that work in the medical field already, and they're the
Great.
first person we call for any kind of information or, hey, this is happening for me, is this normal, so it is very, very helpful. And I think for me personally too, even from my position, although I am not a doctor and a boss lady like yourself in that field, I find a lot of fulfillment in my life and happiness by helping others. And I
Yeah.
think in your field, I'm sure it's a beautiful thing. Like I said, although very challenging, I'm sure at times it's a beautiful thing to see it come to fruition when you are making that kind of impact in so many people's lives.
Oh, it sure is. But I have to tell you, music is part of my life too, and music is very, very important for the soul. So keep on
Yeah,
doing
I
what you're
agree.
doing. Yeah.
Yeah, it's a good kind of medicine. It'll
Yeah.
pass time in quarantine too. That's for sure.
Yeah. Yeah. Definitely.
Amazing. Well, thank you so much for your time.
Oh,
And
sure.
I really appreciate this so much. And I hope that, if there are other things that come up, we can keep touching base with each other and we can keep educating, the ones that we love and feel so passionate about, so that
Definitely.
they can
I
be
I need to
empowered.
follow you on Instagram.
Yeah, I'll follow you back, girl.
Okay.
Definitely, for sure.
Okay. Okay. Great. Thank you very much.
Thank you.
Mhm.